This is the right way to trial a new pair of hearing aids. Hey guys, welcome back to the DrCliffAuD vlog. This is vlog number 255, and today I want to explain to you guys the process that I take my patients through when we're checking to see if a new pair of hearing aids would give them more benefit than their existing hearing aids. But before I do me a huge favor, click the like button, really helps out the channel. And if you're not yet subscribed to the channel with notifications turned on, go ahead and do that as well. It is greatly appreciated. So over the past couple of vlogs, I've been explaining to you guys the process that I take my patients through when they come in for their initial consultation and hearing test, as well as their initial hearing aid fitting, and why it takes so long, because my initial consultations are 2 hours and my initial hearing aid fittings are 75 minutes, which are both significantly longer than the industry standard. So there's been a lot of, back and forth and discussion in the comment section of those vlogs that it led me to the concept of, well, what if I'm not having a new patient come in to get treatment from me and we're just upgrading their technology to a new pair of hearing aids? Do I really have to be as extensive in that refitting process of new technology so they can see if the new hearing aids are actually better than their old hearing aids? So I decided I'm just going to kind of explain the process that I go through with my existing patients when I'm checking to see if new hearing aid technology would actually be better for them. So a lot of the ways that this is done in the hearing aid industry is that you get excited about a new pair of hearing aids, or your hearing care professionals like, you know what, new hearing aids have come out, why don't you give them a try? And so what they do is they essentially upload your program settings into those hearing aids, or they'll do a first fitting of those hearing aids where they're not fully customizing it for you, but they're putting them in your ears, hitting the auto program button. You go home, you check and see if they're actually giving you any benefit. And in some cases, they do give you a significant amount of benefit, and you're like, great, I'm going to go ahead and upgrade my hearing aids, I'm going to purchase them, and I'm going to be good for the next 3 to 5 years. Well, there's other people who go through that process and they're like, I'm not noticing a big difference between my current hearing aids and the new hearing aids that I'm trialing. The problem with this process is that when you get hearing aids first fit to you and they don't go through the exact same refitting of new technology on you, you don't really know if the reason you're not getting benefit from the new tech is because they didn't go through that comprehensive process, or if those hearing aids are just not any better than your existing hearing aids. Now, if you've waited anywhere between 3 and 5 years or more from your previous generation of hearing aids to the next generation that you're looking to upgrade to, then chances are that technology is substantially better. So if you're not getting a significant improvement in that 3 to 5 year newer technology, something is probably wrong. And chances are it's not the hearing aids, it's the way that they've been fit and programmed to you. So anytime that I have a patient who's like, hey Cliff, I saw that latest and greatest video of the new hearing aid that you were talking about, I really want to give that hearing aid a try. I'm like, okay, well, if we're going to try it, I'm going to take you through a comprehensive fitting sequence with those actual devices, because otherwise you're not going to be able to determine if those hearing aids are actually better. It's a waste of time to just auto fit them, have you go home for a couple of weeks and see if they're any better, because if they're not any better, you have no idea whether it was due to the lack of programming customization or if the hearing aids just weren't that much better. So what I do is when a patient comes in, I've got the new tech, I've already run them through test box measures to make sure that they're actually performing the right way. I sometimes will use trial devices, but other times I'll use actual hearing aids that I have ordered from the manufacturer to fit them with. Oftentimes, if that happens, we'll have the patient pay for the hearing aids at the start of their refitting trial or new technology trial. And then if they're demo devices, obviously they don't pay for anything unless they determine that they like the hearing aids and their performance, and then we order them their new devices. So when they come in for this hearing aid fitting, 75 minutes, what we're doing is we're doing a measurement inside of their ear canals with their old hearing aids. And this is very important because we want to identify what amplification levels they were set at. You cannot just take and transfer the settings from those hearing aids to the new hearing aids and expect them to transfer over cleanly and give them the same amount of audibility. We have to make sure that we're doing real ear verification to measure the amount of amplification for average, loud, and soft level speech inside of their ear canals on their old hearing aids. Because after we do that, we can put the new hearing aids inside of their ears and customize the audio exactly the same way. Now, if they were meeting their prescription exactly, then we would basically say, okay, we're just going to program the new hearing aids exactly like we had your old hearing aids. So the thing that you're comparing is not the improvement in audibility, you're comparing the new digital features and the sound processing capabilities of those new hearing aids. Now, if it's dramatically different, let's say that the new hearing aid technology is capable of getting better amplification than what the old hearing aids were, and that happens quite often, then what we do is we actually create a comparison program. So I will still do the measuring inside of their ears with their old hearing aids, and then when I get the new hearing aids, I'll create a new program for them so they can always do an A/B comparison of the new programming I'm doing with the new hearing aids compared to the old programming that they had. Hopefully that makes sense. Basically, what I don't want them doing is making an assessment of the new hearing aid technology based off of bad settings from old devices. Now, if those were as good of settings as we could possibly get, then that's fine. I want them to be able to make that comparison. But at the end of the day, we want to make sure that they're comparing apples to apples. And if you're just programming a new set of hearing aids and you don't give them the perspective of what the old amplification settings were on the old hearing aids, you're not really comparing apples to apples. Now, you could get away with having the patient literally doing a swap out of their hearing aids. What I mean by that is that you're optimizing the new hearing aids to the best of your capabilities, and then you say, okay, listen, so after you get a few days of adaptation, what I want you to do is take out the new hearing aids that I dispensed to you. I want you to grab your old hearing aids, put those in your ears, and do a comparison of how they sound. Because here's the thing, you might encounter situations where the new hearing aids do not perform any better than what the old hearing aids do, and you know that it's not because you didn't program them optimally, you know that it's because the technology differences are not that dramatic. And so if it were me, I would be like, okay, if I'm not getting a significant amount of benefit off of these new hearing aids that are going to cost me another $6,000 to $7,000, depending on what devices they are, then I wouldn't want to pay $6,000 to $7,000 without getting additional benefit, right? And then at that point, you go back to your old hearing aids that are giving you equivalent amount of benefit, or maybe a little bit less benefit, but not worth the $7,000 reinvestment. And then you can wait till the next generation of hearing aids comes out and do the exact same thing. Now, it'll probably cost you money to, in fact, in my clinic, it costs you money to go through one of these new technology trials because we're spending, again, a significant amount of time to prove whether or not the new technology is actually better. We don't like this placebo effect phenomenon going on to where just because someone thinks that the technology should be better, that they want to stick with that technology. We need to prove it. And that's why we do validation outcome measures as well, where we're taking some of the similar things that we use when we fit you with your first set of hearing aids to see, like, okay, hearing and understanding speech on the TV, understanding my wife from across the room, understanding my grandchildren, understanding my children, like comprehension of speech and background noise, like all of these things that we're looking for subjective improvement in, we go back and we look at them again and we're doing a comparison. So based on how you were doing with your old hearing aids to the new hearing aid technology, are we seeing a significant improvement subjectively with those particular things that we're using as a gauge for your level of performance with your new hearing aids? And if we're seeing a significant improvement there, then it's like, okay, let's continue on. Let's have you actually purchase these devices and you continue on with the care sequence that you would normally get from my clinic. But if they're responding on their COSI, which is their validation outcome measure, that they're getting no significant benefit from the hearing aids, meaning no improvement on hearing and understanding the TV, not being able to hear and understand their grandchildren any better than what they were with their old devices, not being able to hear their spouse from across the room any better than what they did with their old devices, maybe a slightly better improvement in background noise, like that is not enough of a justification to upgrade into the new tech unless your old tech is like so old that you keep reinvesting a ton of money into them just to keep them up and running. Now, from year to year, technological improvements, unless you're having a really big jump in tech in a particular year, it doesn't usually make sense to upgrade your tech every single year. You're not going to get a significant enough of an improvement from generation to generation for most people. Now, I do have some patients who they get a new hearing aid no matter what it is, whenever it comes out. And that's fine. And if they perceive the benefit, or if they perceive enough benefit to justify the cost and they want to upgrade, by all means upgrade. But it doesn't mean that we cut corners when we're refitting someone with new hearing aid tech just because they know us and they trust us. I mean, I think there's a lot to be said about, people who will just upgrade their hearing aids because their provider says it's a good thing to do. I don't believe in that. I believe that you either show an improvement in performance, both objectively and or subjectively, or you don't upgrade. And that's just really kind of where I stand on that. Nevertheless, let me know what you think. In fact, I want to know what your upgrades look like. Does your hearing care professional go through a comprehensive refitting of the new tech with comparison programs to your old hearing aids? Or do they just first fit you and say, hey, just, you know what, I'm gonna fit you real quick, go home, check these out for a couple weeks, come back, let me know, because we can order you a pair of your own. I'd really like to know what your upgrade sequence looks like, and as always, I'll see you next time.